Well, hi, this is Ken Auerbach from Cartier, Bernstein, Auerbach, and Steinberg. If you or someone you care for has been injured from no fault of their own, please contact Cartier, Bernstein, Auerbach, and Steinberg at myinjuryli.com or call 631-654-4900. Whether auto or work-related, slip and fall, trip and fall, construction accidents, dog bite, medical malpractice, or nursing home neglect, or various other types of negligence, please contact me at Cartier, Bernstein, Auerbach, and Steinberg by visiting me at myinjuryli.com or call 631-654-4900. I will represent you with integrity and passion. Living in pain from no fault of your own can be emotionally and physically detrimental and affect all aspects of your life. Please contact me, Ken Auerbach, at Cartier, Bernstein, Auerbach, and Steinberg by visiting myinjuryli.com or call 631-654-4900 for an immediate and free consultation and the support and representation you deserve. Well, hi, everyone. This is personal injury attorney Ken Auerbach from Cartier, Bernstein, Auerbach, and Steinberg. Welcome back to our program From No Fault of Your Own. I'm here along with my great co-host and my wonderful associate attorney, Amanda Spinner. Amanda, welcome.
Thank you. How are you?
I'm doing okay. And as they know, it's our goal to give everyone an insider's view of bringing and proceeding with personal injury actions as a result of someone else's negligence. And among these areas that we have explored, and we're going to continue to do so, are car accidents, trip and slip and falls, construction accidents, medical malpractice, dog bites, nursing home neglect, products liability, and the serious injuries that often occur. And through our journey together, hopefully we've removed some of the mystery, the uncertainty, and help you feel empowered, knowledgeable, and confident in the process. We are live today, so if you have a question about personal injury, please give us a call at 631-451-1039. It will be our privilege to try to get you an answer and give you an answer. And Amanda, if they do call in, what are we going to do for them?
We will give you a From No Fault of Your Own t-shirt.
So we'd love to do that, and we'd love to hear your questions and try to give you some information. And today, Amanda, I want to start out by asking you how your weekend was.
It was good. It was 80 degrees on Saturday, which was nice. How was your weekend?
My weekend was really nice. Yeah, Saturday was really a surprise.
It was summer.
Right? What do they call? They call that an Indian summer, actually, when it's very, very warm.
Yes.
Right? And so it was really lovely out and enjoyed that. And yesterday, the weather was raw.
Yes.
But, and I watched, I'm a Jets fan forever, as you know. Giants are my number 2 team. But the Jets are my number 1 team, and it had to be, I said, maybe the ugliest football game I've ever watched in my entire life. The Jets won it at the end, but it was the kind of game where I said they won it at the end, but I still was more annoyed about that than at some losses. It's crazy. I know. It's absolutely crazy. So, guess as a Jets fan, I should count my blessings, right?
Yes.
They're 4-3. But I just don't see it sustainable this way. But who knows? I've been wrong once or twice in my life before, but never about my Jets. Usually when I predict that they would lose, they always do lose. And if I think and let myself think they're going to win, that's always disaster too. So it's all right. But we're back
what
here.
Being a Jets fan is.
It is, absolutely. There's no question about it. So we're at a time in the season when there's going to be young children on the street. I think we should talk about that a little bit and try to harp on some things that could be done to protect children and also to make sure that drivers are safe also. What you could do to be assisting and making others safe, but also to make sure you're safe. And nobody wants to be in an accident and have all those ramifications, and nobody wants to hurt anybody. And they call them accidents for a reason. It means that you didn't intentionally do anything. But some of the things that you can do, I think, are important. And what we'd like to do is sort of make you aware of those things today and make you be thinking about them. And Amanda, you got some ideas. I know that. So what do you think?
Yeah, I think it's, like you said, a really good time to talk about this, since tomorrow there will be hordes of children around gathering candy. So you need to be very vigilant as a driver. We're all still most of us are still going to be working tomorrow. So when we come home, likely there'll be kids on the street, parents on the street with their kids. So we just all need to be very vigilant, especially if you're a pedestrian. You need to think about wearing clothing that can be seen in the dark. It doesn't need to be reflective. It would be great if it was. But, don't wear dark colors, especially in all those dark neighborhoods where you're walking around with the kids. You really want to be vigilant. You want to be vigilant as a driver, looking both ways, making sure there's no one there when you're crossing anything. The same thing goes for a pedestrian. You want to look both ways before you're crossing the street, and don't assume that a car can see you.
I think one of the other things that I think would be really helpful is you should wear bright clothing, but also wouldn't hurt if you have a flashlight.
Yes.
Because we want to make sure that you could see where you're going, but also make sure that a driver is going to be able to pick you up. And if you have children that are going out there, I'm sure if they're young, you're going to go out there with them. Please do the same thing for yourself, because you have to be careful also. And you may be very careful with your children and making sure that they're walking up to the doors. But what happens on events like this is it's like a confluence of a lot of bad things that could happen. So the children are all excited and they're running around, and the streets feel like a big playground.
Yes.
And, that's usual and that's normal. But the reality is that they're still public streets, and anything could go wrong on a public street. Those drivers are used to coming down that block maybe without that traffic.
Right.
Or coming down that block without the number of people that are around. And so they may be looking on one side because, let's say, they see a child that's approaching one side of the street, but then there's a child coming from the other side of the street. Same thing, I think, for drivers. What drivers have to recognize is that children and other people are going to be distracted. Mm-hmm. So what I suggest that you do is do the what ifs. And so as you're driving down the road, be thinking, and it's really a good thing to do all the time, is what if X and X happens? And that'll help you control certain behaviors. It'll help you control not using a cell phone.
Yes, I was just about to bring that up. Most importantly, always never use a cell phone while driving. Never text while driving. Obviously, if you have hands-free, that's great, but that can also still be distracting as well, depending on what conversations you're having. So just be vigilant tomorrow, especially because there's going to be a lot of children around, and you don't want to make a mistake. Right.
And it's not that, again, you're looking to intentionally do anything. Of course you're not. All right. But 99.999% of the cases we have, they're negligence cases. It means that someone just didn't act reasonably under the circumstances. And you may have to be the person, the grown-up on the street, so to speak. Mm-hmm. There might be people all over the street not driving well, not walking well, not running well, but you could be a hero, right? And you'll be a hero if you may not even know that, but you'll be able to avoid a circumstance where a tragedy will occur. And unfortunately, it's something that will affect you and your family and many others probably for the rest of their lives. So we don't want that to happen. We always say, in a perfect world, there'd be no accidents. If there are, we are really privileged to be able to help and fight for people to get justice. But we certainly hope to reduce the number of accidents and situations that do occur. So be thinking about those things. And we want everyone to have a safe day tomorrow. When you come home, it's going to be like any other day for yourself, but there's going to be a lot more going on.
Right.
Might be some really neat things that are on the side of the road. If you see them, pull over to the side of the road and look at them. Don't do that while you're driving because you're driving a weapon, really. It's thousands of pounds of steel and other materials. So the other thing that I want to talk about really quickly, Amanda, is we've been harping on the issue of these insurance companies, that they're reaching out to people immediately after they have accidents, trying to get them on the phone and trying to get them to settle out for their personal injuries. Now, that's not for no fault. That's not for their medical benefits, but trying to get to them. And folks, please don't fall for it. All right? Just don't fall for it. If you want, you could always call us at 631-654-4900. That's 631-654-4900, or you can get us on the web at
myinjuryli.com. That's myinjuryli.com.
And we'll give you information concerning that, and we'll tell you how to handle it. We'll tell you how to approach it. But what we don't want you to do is, with respect to your personal injuries, sign off on something that's going to forever bar you now from bringing a claim for what may be very serious injuries. The insurance companies are out there. They're literally out there. There should be legislation that's passed that prevents this. We've talked about having a 6-month moratorium where an insurance company cannot speak to someone about their personal injuries, not about their medical benefits, but about recovery for pain and suffering until they've seen an attorney. And I think that would help things a lot. But something has to be done actively by the legislature because the insurance companies are just doing it and they're continuing to do it. It's just not right. So we will see you on the other side. We have a great guest today, Dr. Paul Priolo, and we'd love to talk to him and find out how he could do and what he could do to make you feel better. So we'll see you on the other side. Well, welcome back to our program From No Fault of Your Own. If you're just joining us, this is Ken Auerbach here with my amazing associate, Amanda Spinner, and my co-host on the program. Amanda, you always bring sunshine to the program. I got to say that.
Thank you.
Yes. You are really loved out there. And we are exploring some of the most important issues in personal injuries caused by accidents. We are live, and if you or someone you know has been injured as a direct result of someone else's negligence, contact us at myinjuryli.com. That's myinjuryli.com, or call 631-654-4900. If you call into the studio, as Amanda told you before, at 631-451-1039 with any question you may have on personal injury, you'll get one of our From No Fault of Your Own t-shirts. We'd love to give you one of those. It would be our privilege to fight to get you justice, and all of our consultations on personal injury cases are always free. It doesn't cost you a dime. And if you do retain us, it's all on a contingency, so you don't lay out any expenses. We'll lay them out. And also, after we lay them out, if we, for some reason, are not successful, you don't pay us them back. We will bear the cost of that. And also, you don't pay us a fee unless we're successful. It's all on a contingency. And we will see you really wherever you need us to see you. We'll come to your home. We do go to medical facilities. Sometimes people need us to go there. We have offices that we could see you throughout Long Island and the boroughs. So give us a shout. We'd love to try to help you. And listen to our program every Monday, when, Amanda?
From 4 to 5 p.m.
And so we are back. We're back in the program. We have Dr. Paul Priolo. He's a chiropractor that's renowned. He's been on our show before, but love having Dr. Paul on because Dr. Paul has always got something new cooking because he's always looking for ways to get people out of pain. And he does handle all kinds of personal injury matters and even people, again, who aren't involved in personal injury, who are having issues with their spine. Dr. Paul, are you there?
I am. Hi, Ken. How are you?
Oh, it's great. Great to have you back. And we're really glad to have you on and sort of follow up and see what's going on in your world. I know you're always up to something. I was asking you just the other day, I said, hey, do you have anything new, any kind of new machines or anything that are sort of out there and being used? And you said something about that you had something going on. And why don't you tell us about it? And we have some questions for you.
Yeah, great. So we have 4 spinal decompression tables, which are the DRX 9000s. It's a brand of table that is very well researched and has a lot of scientific backing regarding the efficacy of it from MIT, Johns Hopkins, tremendous amount of research behind it with regards to how it treats herniated discs, bulging discs, and degenerative disc disease. It does affect people in in the injury world, because many injuries will cause these herniated discs or bulging discs, and then eventually can lead to degenerative disc disease years after the injury. So they've been a phenomenal addition to my practice. Kind of just sets us apart a little bit. When compared to other practices, a lot of the docs don't really either have space or want to take that jump with regards to investment into these tables. But I know the docs who do have them really do enjoy how they, help their patients really, and the outcomes their patients are having.
So, yeah, I've never actually heard anyone or any facility that actually had 4 of these machines. So you're really invested in your patients. I mean, obviously, I know it's expensive. It's expensive to do it, but I think it's, from what I hear and people that have used them or been subject to them, I've never heard anyone have a negative experience. I've heard people saying, help me a little bit, but some people have had tremendous relief from it. One of the questions that I would have for you is the DRX 9000, is the spinal decompression table that you'd be using, is this for everyone? Like all of your patients that come in get this kind of treatment, or what types of patients, and how do you evaluate that?
So it is not for everyone, unfortunately. Some patients are not candidates for it. Some of the contraindications or things that do not allow us or tie our hands from performing this is osteoporosis, T-score of over negative 2.5, patients who have instability in their spine, or spinal fracture, obviously bone infection. So there are contraindications, and no, not everyone will get it. So a MRI and stress X-rays are necessary. The patient cannot get onto the machine without those two studies being performed and reviewed with the actual images, not just the reports from the radiology facility. And then at that point, then they are candidates. And usually, per disc level, it's 24 visits. And I've got a young guy, a 39-year-old guy who had a car accident last August. He went through the 24 visits, discharged him somewhere around March of 23, almost year to date. Funny as it sounds, he got into another car accident a month after I initially examined him, sent him out for MRIs, and the previously visualized lumbar herniated disc that was pretty significant was no longer appreciated. So it's nice when typically you don't really perform repeat MRIs when a patient is feeling better. Insurance carriers don't want to pay about $1,000 for it, and patients don't really want to pay out of pocket when they're feeling better. So repeating the MRIs aren't always done. So in this case, it was exciting. He was excited about it. And yeah, it's nice to be able to serve people with something a bit different than what many of the other offices have, right? So
how does the actual machine work, and what can people expect if they do get this kind of treatment?
So it basically, so for a lumbar, let's say for that patient I was just talking about, the patient initially is standing. They have 2 belts, one belt on the top of their pelvis. After you lay the patient down, the other belt goes underneath their rib cage. That's the stabilization belt. And then the machine, depending on the disc level, will angle the device that is essentially like a seat belt. And it will either be angled at a significant angle or a very mild angle to isolate the disc level that we treat. Then when the machine is turned on, it's a very gradual pull that takes place, and it oscillates, so it increases and decreases the pull. That oscillation is what creates a negative or a sucking type pressure inside of the disc and inside of that capsule that seals the disc. And that negative pressure not only pulls the disc herniation or bulge back to midline, but it pulls in fluids and nutrients back into the disc.
Now that's fascinating. That's fascinating. So the machine itself, right? So what it's doing is it's essentially decompressing that disc. In other words, getting the pressure off of that disc to try to get it back in position and center it back where it originally was before there was trauma to the disc?
Yes, exactly.
So, and you're saying, and we're going to pick this up on the other side because you're giving us a lot of detail that I've never heard before, that the disc itself actually, even with the material now having exited on a herniation, can re-enter into the actual cartilage. So the material inside, the gel, can actually re-enter into the cartilage?
Correct. Get recentered, yes. All
right, well, we're going to get back into that on the other side. And this machine, from what I understood, it was originally either used or invented by NASA. I don't know if that's accurate, but I had heard that somewhere. So
there is, NASA was involved with some of the technology.
Okay, well, we'll talk to you on the other side there. We're not going to let you go. We had a lot of questions. So we'll see Dr. Priola on the other side. Well, hi, welcome back. If you're just joining us, this is personal injury attorney Ken Auerbach, here with my great co-host and associate Amanda Spinner. You're on our program From No Fault of Your Own, and we are live. We're exploring some of the most important issues in personal injuries caused by accidents. If you'd like to call in and discuss anything about personal injury, they certainly can call in, Amanda, right? It's 631-451-1039. And if you or someone you care about has been injured as a direct result of someone else's negligence, contact us at myinjuryli.com or call 631-654-4900. It's myinjuryli.com or call 631-654-4900. It really would be our privilege to fight to get you justice. All of our consultations on personal injury cases are always free. And if you do retain us, it doesn't cost you anything unless we make a recovery. It's called a contingency fee, and we'll lay out expenses. And you won't have to pass those back either if we're not successful. And listen to our program every Monday from 4 to 5 p.m. as we do explore these issues. We are sponsored on our program today, Amanda, by who?
PD's Caps and Taps.
That's right, PD's Taps and Caps. It's at 668 South Country Road in East Patchogue. And it's a great place. I mean, unbelievable wings, unbelievable food. You go there, get your drinks and your food. Great place. They have TVs all over the place. Go there, watch the game tonight. They can watch Monday Night Football. And if you do mention that you heard this commercial, you will tell them you heard it on From No Fault of Your Own, and you will get 10% off your bill. Tell them that before you start ordering. And so we'd love for you to go over there. You'll enjoy the place. You'll go back. I promise you will go back. And you may actually get to see Petey. Petey is one of a kind, amazing, amazing young man. I get to call him my nephew, but it's a great show. It really is. So it's a great show to be there watching everything going on. And Pete's also got all of his hats lined up on the walls. He's got 1,800 of them. And the new thing that people are doing is they're trying to go there and bring a hat. Once they get to know him, bring a hat, seeing if he doesn't have it.
Oh, that's nice.
But Petey doesn't really care. If Petey has doubles or triples, Petey believes the whole world is a cap, and Petey believes in beautiful caps. So we believe in Petey. Petey believes in beautiful caps. But get over there to Petey's Taps and Caps at 668 South Country Road. So we are back on the show now. We got Dr. Paul Priola, and he was telling us about the DRX 9000 and those machines that they've invested in his chiropractic practice to try to get people out of pain. He was telling us about a 39-year-old man who actually utilized this machine and did really well with it, had 24 treatments, and the following year, unfortunately, was in an accident. When they did the MRI showed that the disc that they had been treating that was herniated was no longer herniated. And, I mean, that's really remarkable. That's amazing. Great news and amazing. But as a follow-up to that, Dr. Priolo, my question is let's get back to sort of how this works. So does this machine work like an inversion table? Now, I have an inversion table at home. I believe in decompression. I believe in chiropractic 100%. And I think there's so many people that get relief from it. Have you had any experience with inversion tables? How are they different? Could you use them also if you are doing this treatment? And if you could explain that.
So inversion tables are very, very different. They do not isolate a disc level where these machines are able to do that. And there are two schools of thought with inversion tables and versus decompression. Most of the decompression gurus really poo-poo the inversion tables because they're in kind of an arena that is a lot more sophisticated, and that's, the inversion tables are not that sophisticated. So do I like them? I actually do like them. I think it's a great, great home device for people to use, kind of similar to a toothbrush. However, there are contraindications to distracting or decompressing the spine, regardless of the device that you're using. So that is the only thing that comes to mind with regards to being cautious for people who are at home using those things.
But I think, I'm sorry, based on what?
Based on those images I had mentioned earlier, the deflection, extension, stress x-rays, as well as the MRIs.
That's fair. So you're saying that it may be a good device to use, but it would sound to me is that a person who's using them should at least be going to get professional consultation, should be coming to your office and really getting evaluated. And it may be that you will say, no, look, this isn't something that you should do because I looked at your MRI or I looked at your x-ray and you really are not a great candidate. You're going to be putting pressure or some type of pressure on the part of the spine that may not be good. But if a person does come to you, that would be something that you'd be able to sort of give them a little bit of guidance. And it sounds like, at home, where you go and a doctor says, look, when you go home, do these home exercises. It sounds like something like you could sort of maybe include in it if you're the right kind of candidate, but you really should be going and having some professional treatment if you're really having those problems, because you could do more harm than good. And also, you really, again, you don't know what's going in there in the spine until you do know what's going on. And it sounds to me like that's something that can be used, but really should be, again, recommended by a doctor. Don't just jump into it and do it, not knowing what is actually going on. Is that a fair way to sort of summarize it?
Yes. Yes, it is.
And if someone wants to get in touch with you and your office, Dr. Priolo, can you just give us that information?
Yes, I am located at 2805 Veterans Memorial Highway, Suite number 8, and in Ronkonkoma. I'm sorry, our office number is 631-676-6324.
So give them that one more time so they can write it down, because now they know that they really should go see you and try to get some help.
Great. My address is 2805 Veterans Memorial Highway, Suite number 8 in Ronkonkoma, New York. And the phone number is 631-676-6324.
So let's talk about now, how does the disc, right? So for people out there that haven't heard this before, and you've been kind enough to teach us on the radio about the spine. The spine is made up of bones, vertebrae they call them, and in between those vertebrae are the shock absorbers, the spongy tissues that act as shock absorbers, but they also allow our spines to be able to move and have a range of motion, right?
Yeah.
And so the disc, when it herniates, if one was to think about it, and I've heard this picture, I didn't invent it, is sort of the picture of the jelly donut. And the jelly donut, the donut part itself being the harder part of the outside, which would be the cartilage on the outside. And the disc itself has inside of it, that's called the nucleus, which is a gel. And the outside, that's the cartilage, is the annulus, correct?
Yes.
Okay. And so tell us, when the outside part of the disc now is injured, right? There's trauma to it. There's a whiplash. There's trauma to it. And now this material now has leaked out, okay? This gel has come out of it. How is it that a DRX 9000 now, how does it work? How is it getting potentially the material back in there? And if it isn't, how is it otherwise giving relief to the patient?
Okay, so imagine that disc or that jelly donut around each disc.
You know what? Hold on a second.
Yep.
I'm getting hungry now, and we're coming down to the end of this. So when we come back on the other side, we're going to jump really right into it. Okay.
Great.
I've been actually watching my weight, fortunately, but jelly donuts is not a great picture to think of. Okay, when you're trying to do that. So what could I think of, Amanda?
I don't know.
Doc,
Because right now, all I'm thinking is jelly donuts.
That's all I could think of, Doc. Everything else has left my mind now, and it's nothing but the jelly donut. So we will have Dr. Priolo back on the other side. We'll be talking about the jelly donut or your disc. The thing is about a jelly donut, it doesn't cause pain. A herniated disc causes a lot of pain. So we'll see Dr. Priolo on the other side. Hi, welcome back to our program From No Fault to Your Own. If you're just joining us, it's Ken Auerbach and Amanda Spinner. And we're talking about some of the most important issues in personal injuries caused by accidents. And if you or someone you care about has been injured as a direct result of someone else's negligence, please contact us at myinjuryli.com or call 631-654-4900. That's myinjuryli.com or call 631-654-4900. It would be our privilege to fight to get you justice. All of our consultations on personal injury cases are always free. It doesn't cost you anything. If you do retain us, it's all on a contingency. It doesn't cost you a dime unless we make a recovery. We'll also lay out all the expenses, and you will not have to reimburse us if we're not successful. And listen to our program every Monday from 4 to 5 p.m. as we explore these issues. So, Dr. Priolo, we're back to the jelly donut. And so tell us, though, how does that work? Okay, so the jelly donut, if people are out there thinking, is the outside of the disc that's in between the different vertebrae. And there's nerves, right, that are coming from the outside of the vertebra. Those are called nerve roots. And there's also inside the spine, you got the spinal cord, right? Did I set that up correctly?
You did.
Okay, so tell us now. You have this person. They come in. They're in pain. Let's use the 39-year-old person. Okay, obviously we're not using any names here, but that person's in pain. And you now evaluate them, and you ultimately believe that the DRX 9000 be the appropriate, would assist you in trying to get this person better. So tell us how this works, and how is it now that it's possible that you could get a person like that out of pain? Why are they in pain in the first place? How is it getting them out of pain? And do you use this in conjunction with other techniques as well? So I know I asked you a lot of questions, Doc, but we're picking your brain here, and we love to do that for our listeners.
So here we go. So a good analogy that I believe is that disc is a sealed capsule, right? So the analogy that I give a patient is take a plastic gallon of water that's filled, take the top off, and invert it completely upside down. As the water is coming out and there is a difference in pressure inside of that essentially cell of plastic, right, which we are going to compare that to the disc, and inside of that disc right? There's pressure because of the capsule. When you pull the disc or the bones apart, isolating a disc level, it creates that same negative pressure that is occurring in that gallon of milk or gallon of water, that's now essentially imploding on itself, kind of like a sucking or negative pressure. So when you do these treatments, and the studies have shown 24 treatments are the most effective over a 8 to 12 week program, the bulging discs, herniated discs, or degenerative discs are greatly reduced, and the success rate is between 80 and 90%. Wow. So it's pretty impressive.
And what does it feel like for the patient while they're getting this, done?
So it feels like a pulling type tug, either in the cervical spine or the lumbar spine, depending on the patient and what their experience is. Increase or decrease in the strength of the pull will be made. I will make those changes. Mm-hmm. And it is used, Ken, to answer your question earlier, in conjunction with other therapies. We have physical therapy at the office as well. So we're doing the modalities that are going to increase or decrease blood flow, stretching, some rehab when it's the time in their care plan. And sometimes other providers are called in where pain management might be indicated for someone who's having significant muscle spasm.
So could I ask you this question? So let's say, obviously, during this procedure, and it's possible as someone's getting better, they're having a lot of pain. They're having acute pain. So that person could come to you, could be going through this regimen of these different types of modalities, including the DRX 9000. But if they're having a lot of pain and you want to try to manage that pain so they can get through the regimen, then it's possible that you may have them see a pain management doctor and do something like that. So you use it in conjunction with some of these other disciplines? Correct.
Yes. And I get referrals from very well-respected spine surgeons in the area where for this actual machine before they ultimately enter into a surgical situation. And they will, we will be in contact and let them know what the patient's situation is. Sometimes they'll call in a Medrol dose pack for the patient if the medical doctor thinks that's necessary based on their clinical presentation. So yeah, it's the nice thing about coming to my office is the doctors who I refer to are just a phone call away, and I really am always in close contact with them to have a patient really have the best outcome they can.
Well, that's what I love about your practice, because I know I've had clients that have been in your practice, and you're very open-minded to the idea that not everyone's different, right? Every person's different. So each person is treated that way. Each person is evaluated that whether or not, you can do different modalities on them. But if you can't, you're not afraid to go ahead and say, you know what, we could use a different discipline to either assist us or to help us get you better. And to me, I always find that is the most important thing, because obviously the ultimate deal is to try to get this person better and out of pain. But sometimes some practitioners, they're nervous about that. They're nervous about having another discipline get involved in it. And I know you're not, and I think it's important. I think it's very important. If people want to get to you again, though, could you tell us what the phone number is that they should call you at, call your office? How many days a week are you guys open?
We are open Monday through Friday, and my phone number is 631-676-6324.
And with regard to your office, do you generally have regular hours? What would the regular hours be?
We're open between 8 and 9 a.m. every day, 8 on Monday, Wednesday, Friday, 9 on Tuesday, Thursday, and we close at 7. So we're here a decent amount during the week.
Well, that's good. That's good. That's a lot of hours. And what's nice, too, is you have hours it seems like before people might have to get to work and also after. And so the easier it is for someone to go ahead and be able to do that, the better. I know a lot of things out there, folks, are good in terms of seeing it online or getting information. But the reality is that if you do have spinal issues and spine issues, whether it's from an accident, I know Dr. Priola does no-fault cases, and he does regular medical cases through medical insurance, and really go see them, because you're not going to be able to go ahead, and I can tell you this for sure, I've been doing this for 35 years, you're not going to be able to get right if your spine isn't right by just looking at something, on the internet. It's not going to work that way. You need a hands-on doctor such as Dr. Priolo, a practice that is really open-minded, bringing other disciplines in. And Amanda, I think ultimately we always say, right, that we want our clients to get better, right?
Yes, that's our number one goal.
And so, Dr. Priolo, we only got about a minute and 20 seconds to go. What types of people do you treat? I mean, I know you do motor vehicle cases, but how and where do people come from in terms of where they've hurt their spines?
So we do take private insurance, Medicare, workers' comp, no fault. Really, they come from all different walks of life. We get referrals from primary doctors, orthopedic surgeons, spine surgeons, neurosurgeons, even psychologists. So, it's, to me, it doesn't really matter who is the payer, right? A person is a person. Their condition is their condition. Doesn't matter if Medicare is paying for it, if, Coca-Cola is paying for it, if one of the no-fault carriers is paying for it, or...
Well, I really, and I know Amanda, we really appreciate you coming on the show. You've been on before. We'd love to have you again. We had some other things we want to go on to. I know really was very interested in the DRX 9000. That's Dr. Paul Priolo. And folks, call us if you need us at 631-654-4900. It's 631-654-4900, or get us at myinjuryli.com. It's myinjuryli.com. Have a great week.
See you next week.